So you've all heard of disc herniations as probably the most talked about cause of back pain. So let me ask you another question. So among all causes of back pain, what fraction are caused by disc herniation? How many for less than 5%? How many for 10? How many for 50? All right. It's actually 4% or so, or less, very small number. So if you look at all groups of patients, about 97% of pain is thought to be mechanical or caused by altered spinal biomechanics. Only 1% have a non-mechanical cause. And one of the main problems with imaging that we experience is that it's excellent for evaluating the rare non-mechanical cause that you see below: a patient with cancer, patient with infection, some sort of spondyloarthropathy, but it really falls short of the mark for the far more common mechanical causes. Now, why is that? The problem with MRI is that both symptomatic and asymptomatic patients have an array of abnormal findings, particularly on MRI, which is the best modality that we have to evaluate these patients at this point. Another pitfall of MRI is it doesn't predict the outcome of patients who have back pain. And this is a well-known study in 246 patients. They got an MRI follow-up at 6 weeks. They found that the herniations were equally common in patients with back pain and patients with radiculopathy alone. On follow-up studies, the herniations changed over time. Some got better. Some patients had new herniations that were asymptomatic. But most significantly, there was absolutely no correlation between the herniation, the size of the herniation, the type of the herniation that was there, the behavior of the herniation, whether it moved, or, and the presenting signs or symptoms. And there was no correlation between how it changed over time and the ultimate outcome in the patient. So 2 strikes against imaging. It's not specific, and it doesn't predict outcome. Well, just like imaging, clinical assessment really falls short. There's no strong physical exam findings that can predict whether a patient has a disc herniation or if they have cancer or a spondyloarthropathy or a fracture. Why? The answer really goes back to how we're built. So no matter what the underlying cause, our ability to discriminate where the pain is coming from is limited by the wires that transmit the signals. So the nerves that supply the back are very complex. The brain can't really distinguish between the different signals well, and the body is just unable to tell what the cause is, and neither is the clinician. The final piece of the puzzle that most interventional treatments of back pain have a very modest success rate, especially surgical techniques. Now, this is very controversial. There's only been 4 large clinical trials for surgery versus non-surgical care, and they're summarized here. I'm going to draw your attention to the final line, and that shows the difference in improvement in outcome between surgical and non-surgical treatments. So looking at these numbers, you can see at best there's modest improvements with surgery, and in a best case scenario close to 20%, but in most situations about 7 or 8%, and in one study actually the surgical patients did not fare very well.